In the heart of Nigeria, where the sun casts a golden hue over the vibrant earth, a visionary emerged, Professor Oyewale Tomori, a name synonymous with hope and resilience in the realm of public health. His life's work has not only shaped the future of virology in Africa, but has also inspired a generation of scientists eager to follow in his footsteps. Professor Tomori's journey began in the dusty halls of Ahmadu Bello University, Zaria, where he first studied veterinary medicine. The air was thick with the scent of ambition and determination, the sounds of students engaged in fervent discussions echoing through the corridors. But beneath the surface of animal health, Tomori found a deeper calling, a passion for viruses that danced at the edge of human existence. This realization propelled him to the University of Ibadan, where he earned a PhD in virology. By the time 1981 rolled around, he had ascended to the prestigious role of professor at the same university, a beacon of knowledge illuminating the path for countless budding scientists. Yet Professor Tomori was not content to remain solely within the walls of academia. With an unwavering belief in the power of education, he took on the mantle of founding vice-chancellor at Redeemer University. Here he wove together leadership and scholarly pursuits, nurturing an environment where young minds flourished like the lush vegetation of the Nigerian landscape.
My name is Oyewale Tomori. I'm a veterinarian and I'm a virologist. I spent a lot of my life working at the university level up till about 1994 when I joined the World Health Organization. But I came back to Nigeria to gain back to university for a private university and then retired in 2011. So my area is more like infectious disease, disease prevention and disease control.
The real test of his mettle, however, awaited him beyond the classroom in the chaotic dance of infectious disease outbreaks that plagued West Africa. Tomori plunged into the front line of battle against Lassa fever, yellow fever, and polio. Each investigation was a race against time, each moment heavy with the urgency of saving lives. In the years that followed, as the world grappled with health crises, Tomori stood as a trusted advisor to global health organizations.
So the title is Prevent Epidemic. And how do you prevent epidemic? By immunizing. If you look at the picture on that side, if only some of us are vaccinated, look at the ones that are vaccinated, the guy in red is the danger. So the yellows are few. Because they are few, when the red man comes in there, it's going to affect all the other people in blue. Look at the one on this side. If most of us get vaccinated, if it all becomes yellow, that red man can only affect one or two, or only one person. That's how you prevent epidemic.
His voice, rich with experience, guided the World Health Organization's African region and the Africa Centers for Disease Control and Prevention through critical campaigns. The echoes of his strategic insights resonated across borders as Nigeria edged closer to eradicating wild polio. Even in the face of the COVID-19 pandemic, his leadership shone brightly, rallying efforts to safeguard the continent. What truly sets Professor Tomori apart is his unwavering advocacy for stronger public health systems throughout Africa.
Since I was born, we've been talking about capacity building, but we never mentioned capacity retention. And what is capacity retention? It is creating the enabling environment for the capacity you have built to stay and function. But when you train me, and I have nowhere to work, like doctors, see a lot of our trained doctors are all going out of the country because there's no facilities for them to work with. So while you are training and building capacity, you must also think of creating the enabling environment for that capacity to remain in your country and do the work. But we're not doing that. And that's the issue of in short, what happens? We're ready to build roads all over the country, but when the potholes start coming, nobody looks at it until the road is bad again. So that sustainability culture, maintenance culture is not there, and we have not gained it, I think, unless we begin to see all those things. It's just like we say, it's cheaper to prevent than to control, and especially with diseases. And the amount of money that you spend on prevention is so minimal compared to the losses you get when the disease you start doing disease control. So I think we need to change our attitude to that one.
He became a mentor, a nurturer of dreams, empowering a new generation of African scientists and health professionals with the knowledge and passion needed to carry the torch forward.
Has authored and co-authored over 180 scientific publications. He is currently President, West Africa Network of National Academics. Ladies and gentlemen, Please let's welcome to Excel Right Professor Oyewale Tomori.
Thank you very much. After you have eaten pounded yam, it's not easy to. So it took me some time to get off my seat. Actually, this is my first time here, and this is wonderful. I'm really so excited about what I'm seeing. This is so beautiful. Even your toilet rolls are very soft. You know, not like the sandpaper I use at home. I've been to the toilet 4 times now just to enjoy the toilet roll. And you know, this is Excel Right. You know, in Nigeria, we do a lot of things. But I like the title. We do Excel wrong in Nigeria. You know, this is a difference between the two. But we excel in doing the wrong thing in this country. So you can know why I'm really excited.
His own accolades: Nigeria's National Order of Merit, early recognition from the U.S. Centers for Disease Control and Prevention, and membership in esteemed academies worldwide, were but stepping stones in a life dedicated to service. Through it all, Professor Oyewale Tomori's story unfolds as a testament to dedication, wisdom, and leadership. Each research paper written, each student mentored, each life saved, tells the narrative of a hero whose vision and perseverance continue to illuminate the path toward a brighter future. His legacy is a reminder that behind every public health victory lie the stories of those like him, whose tireless work transforms lives and communities across the continent.